all of them, but I want to
This meeting is being recorded.
make sure that I answer some obvious questions first that you guys may have. So, no? Okay. Can you hear me well, by the way? Okay, good.
Yes.
Okay, thank you. I want to make sure that my audio is good enough. Okay, good. So I have a list of questions in here. Again, feel free to ask me more if you can think of something, but otherwise I'll go from here. Right, the first question is, what can I do to improve my low white count? Now, as we, oh, actually, maybe I can also use the chat function here, right? Yes, good. So if something important, I will write down for you and I'll write down on the chat box on your right hand side, I suppose. So what can I do to improve my low white count? As we get older, right? Typically, we may suffer from low white count, but also low red count, right? Both the white blood cell and the red blood cell, both of them can be lower. So it has a lot to do with bone marrow getting older. So the again, right? Of course, when it comes very low, we have to give medication for that, right? But from a when it's a little low, like not too bad, right? Is a reflection of bone marrow aging. So from a dietary standpoint, right? You will hear me say that I typically recommend bone broth, right? Either bone broth or for those of you that has the appetite of even more fancier, then I even would say bone marrow soup, right? For those of you who has the appetite, right? So that's where I would start, and then you can go deeper, right? So there are some scientific evidence that certain type of mushrooms, right, medicinal mushrooms, right? Like for example, reishi or reishi, if you say that in, I guess in the Chinese, right? Certain type of medicinal muscle has also been shown to improve bone marrow health, and therefore it could, right, help increase white count or red blood cell count, right? So that's the basic. I will go from there. Of course, right? If it drop very low or lower, we have to do some workup, right? We have to make sure that your bone marrow is not sick, right? And of course that would be more of a medical issue. But as we get older, like I said, we generally will begin to make less, right? So those I'll start with that. Yeah, okay. So I hope I answered that part. How do I improve my low white count, provided it's not too low, right? We don't want that to be less than 2, by the way. The white count, look, typically, right, we don't, when look at your report, we do not want it to be around 2. Oops, that's too low, right? So we really want to be, ideally, if you go back to look at your report, you will notice that the minimum is 4, right? That's the number I'm looking at. So anything less than, right, closer to 2, I worry, right? Then you will start to have, you may start to get infection easier as well for white count, okay? Uh, and then second question is, how do I raise my MV, high M? Yes, okay. So oftentimes you will see that in your blood work, MVC, right? MVC simply means, in a way, is how big the red blood cell is. And MVC is how big it is. And it can get bigger or smaller, depending on what goes on with the red blood cell. For example, if we are iron deficient, then my red blood cell will shrink. When the red blood cells shrink, the MVC will drop, will get lower. The number will be lower. For example, if you look at your labs that I go over with you in your when you see me, you will notice that, oh my gosh, the MCV could be as low as 70 or lower. On the other hand, if you have B12 deficiency or folate, right? B12 or folate. B12, sorry, I write this down, or folate. Folate is actually B9, for those of you who don't know, okay? It's B9, okay? When they are deficient, then your red blood cell will swell. And when your red blood cell swell up, the MCV will get bigger. And the MCV get bigger, it would be like above 90. And you can see that in the labs. So I see a lot of you, right, with MCV over 100. What does that mean? Well, when your MCV is over 100, then we know that by definition, you are probably B12 and or folate deficient. That's why I will always say, oh, wow, you need to be on B complex, right? When the MCV is high, high means closer to 100 or higher, then that means you're B12 folate deficient. Then I'll always say B complex. But then you're going to say, but Dr. Chen, that's not right. Why? Because look at my B12 level in the blood, right? When we measure B12 in the serum, which is the blood, right? And oftentimes you may say, but Dr. Chen, that doesn't make sense. My B12 is high. My B12 is 1,000. That's not low. Why are you telling me that I need to be on B complex? No way, my B12 is high, right? Are you killing me? Are you crazy? No. Why? Because there's another marker called homocysteine, which I do in any of you, especially when we were doing the U-Restore lab test, right? Homocysteine is a measurement of, in a way, indirectly, right? I'll put that in very simple terms, is another marker to tell me your B12 inside the cell. So you may have good B12 in the blood, but that does not mean your B12 is in the cell. Well, how do I know your B12 is in the cell? I cannot open your red blood cell and look inside, right? So just because you have enough B12 in the blood, which we measure, that does not always mean you have enough B12 or folates inside the cell. So how do we tell that you have enough B12 or folates inside the cell? Well, one way to tell is to look at your homocysteine level. If your homocysteine is over 10 or higher, then I know your B12 is not getting inside the cell. You may, right? And a very common example I give to all my patients is this. Just because I see the Safeway truck at Highway 69 does not mean you get the local Safeway well stocked, right? I see a truck on a highway, but but it's not, that doesn't always mean that the local Safeway is well stocked up. Same thing, just because I see B12 in the blood, oh my gosh, you're 1,000, right? Sometimes even higher, but that doesn't always mean you get enough in the blood. Inside the cell. And inside the cell is important, right? If I cannot get the B12 or folates inside the red blood cell, the red blood cell will continue to be swollen, will get big. So when your red blood cell continues to be big, your MCV will remain high, right? Over 100. And I see that every day, right? Look at your report. If your MCV is over 100, I know your B12 is not getting inside the cell, even if you have enough B12 in the blood. So looking at homocysteine is one way to tell. So what do I do? Well, there are two things we have to do. Number one, we need to make sure that we have high enough B12 to push through right? The barrier to get inside the cell. Number two, we also have to make sure that we are using certain type of B12 or folate, right? We want to make sure that they are methylated, okay, versus cyano. If you go and get most over-the-counter B complex or B12 supplement, you will notice that their B12 is called cyanocobalamin, C-Y-C-Y-A-N-O, cyanocobalamin, cobalamin. Okay? Cobalamin means B12, that's it. But cyano is the one that we typically use. And that is not a well-absorbed B12 to go from the blood into the cell, right? So in order to get the B12 and folate to get into the cell easier, always look at your B12 or B complex to make sure that it is methylated, not cyano. Am I clear? You always want to use methylated B12, not cyano B12. Okay, even though cyano is routinely used. Okay, all right, so that's how I would say you want to get high enough dose of methylated B12 to help push through the barrier. Okay, so that's, I hope I answered that question. Number three, some patient would like to know, can I use ALA, which is alpha lipoic acid, or commonly known as ALA, to treat neuropathy? Absolutely, right? In fact, I would combine, the second question is, what type of natural remedies can I use for neuropathy? There you go. Always a combination of B12 and other B complex. I'm sorry, Dr. Chan, what is the difference between B12 and B complex? Well, B12 is just B12, but B complex is more, right? B complex typically is B1, B1, 2, 3, 5, 6, 9, and 12, right? So don't worry about the names. So, but that's right. And typically, when I give you a B complex, it does include B12, but is of a lower dose. So that depends, right? Initially, I oftentimes will start with B complex. But if necessary, if that is not helping you, then I will go to B12 directly, okay? So to treat neuropathy, yes, you want to use three things, a few things. Alpha lipoic acid. What else should you be using? B complex, right? Especially B12. Especially B12. What else should you be using for peripheral neuropathy? NAC, right? NAC stands for N-acetylcysteine. And this is another nutritional supplement that has good data to help with that. So I will usually look for a combination of alpha lipoic acid, N-acetylcysteine, and B complex, right? But of course, we want to make sure that the dose is high enough. And so that has to be individualized, right? How much do we need depends on you, right? Some people need a higher dose, right? So we start low, of course, and then we'll build up the doses, okay? And then of course, right, the medication is always Neurontin, right? We know that, yes, you can use the medication typically for neuropathy, it's simply Neurontin or gabapentin, right? And you know, even with Neurontin or gabapentin, right, we have to build up the dose, right? Even with a drug, right? We start with 100 milligram 3 times a day, right? To start oftentimes and build that up all the way to 900, right, milligrams, a day or more, sometimes even more. I have patients up to 1,200 milligrams of gabapentin a day as well, right? So drugs, right? It's the same, right? When it comes to medication or your nutritional supplement, it depends. But at least the combination of alpha lipoic acid, B complex, and NAC is a good starting point for peripheral neuropathy. And then we just have to up the dose, right? To make sure that is the right dose for you, right? And then next question. Am I going too fast? No, Heather, you can let me know if I'm going too fast, because I could if I get too excited, then I get too fast. So sorry. Heavy metals in seafood. Yeah. So for those of you who are concerned with heavy metals, we could, right, actually test for that to see if you have too much. And if we see you have high levels, like of course, mercury, right? Mercury is the number one thing we are concerned with in seafood, especially tuna. And if the mercury level is high, then yeah, so we want to test for that, right? And then if it is too high, then we have to do something called chelation therapy, right? And that is something that I would, sorry, I spelled therapy wrong. It's RA, not AR, right? So I would have to refer you to a place to do that if you have heavy metal toxicity, right? And for those of you who are curious, we can order the test. But even that has different level, right? Typically, we start with a blood test, maybe urine test, and we start from there, okay? So let's see. Next. So far, so good. Is there anything I mentioned? I'm sorry. Is there anything I mentioned so far that said I'm confused? I'm confused. Repeat again. Is there anything I said so far that you would like me to repeat? Because I was just so confusing. Okay, good. Next question. My allergy came back with many food allergies. What do I do? Yay. I love that question because when you ask the allergist, they will say, sorry, you have just to avoid all of them. Don't eat from now on, right? Of course, that's crazy. By definition, if you have more than 5 things that shows up on your food allergy testing, you have what we call leaky gut until proven otherwise. Leaky gut, of course, is the layman term. Dr. Chen, that doesn't sound very scientific. Good, let me give you the scientific name. It's called intestinal permeability. And that makes it more believable, right? If I give you a scientific name. So intestinal permeability, which is leaky gut. That means what happens is the gut lining is becoming leaky, right? So imagine the intestinal cells, they're supposed to be tight, right? But what happens is as we get older, right, the space between the cells are open like this, ooh, right? You see that? So when there's a gap in the cell, things start to leak inside to the intestine. So when things begin to leak into my gut, it creates what? Allergies, right? It creates an immune response. So when stuff, because my gut lining is leaking, stuff begins to leak into the cell, creating an immune response, right? And the immune response creates inflammation, which is the basis for food allergies. Of course, for those of you that I have spoken about your food allergy testing, remember we test for 3 types of reactions. We talk about IgEs, which I typically says, you know what, this is just like the military. We talk about 3 branches, right? We have the Army, we have the Navy, and we have the Air Force. So IgE is the Army, right? And IgE, when you look at the report, right, it kind of tells me about things that you can get itchy too, itchy, right? But then there are other reactions like IgG4, which is like the Navy. And you also have C3D, which is like the Air Force. Right? So we have three major divisions in the immune system that we test for. IgE, like the Army, will give you typical allergy reaction. But IgG4, the Navy, or C3D, the Air Force, right? Those are in your report, right? Will give you a slightly different symptoms. They tend to give you not itchiness, but they will make you feel tired. They can make you achy. Oh my gosh, I have a headache. I have a migraine. I have joint pain. I have muscle ache. Also, tummy ache, right? Abdominal pain, right? Things like that. Those are mediated by the Navy and the Air Force of the immune system. And typically, we don't call them allergies. What do we call them? We call them sensitivities or intolerance. Either way, right? So we basically talked about food allergies and food sensitivities or intolerance. But unfortunately, most doctors will simply ask you to, well, avoid them. Don't eat too much of those. But is there anything else I can do? Especially, Dr. Chen, when you tell me that, hey, my gut is leaking. Thank you. That's the basis for food allergies. But what can I do about it? My gut is leaking, opening. Can you close it for me? Can we close it somehow? Well, yes, right? And for those patients who ask about that, I typically would talk about the following. I talked about the 5R approach. Okay, and I will briefly go over them right now with you. The first R is to remove, right? We try to remove those obvious food that you should avoid, right? Those that really, if you look at your report, if anything score above 3 or higher, we really should minimize those food, right? So we typically call that elimination. And Heather, I am sure she's an expert on how to advise you on elimination diet. So that's the first part we call remove. Second R is replenish. Right? And what are we replenishing? Oftentimes, we want to replenish digestive enzymes. Because as we get more mature, remember in my practice up north, I do not say when we get older. We don't get older, we only get more mature, like wine. We get better as we get more mature. And so with age, right, we make less digestive enzymes from our pancreas. So when we don't make enough enzymes, food don't get digest well. When they don't get digest well, right, they can come through the leaking in my intestine and cause problem. So one way, right, to reduce that is we want to make sure that we digest our food well. Well, how do we do that? Well, of course, we don't. Number one, always chew your food, right? Some study shows that you have to chew up to 12 to 21 times before you swallow. Number two, really do not dump cold water, cold icy water. Because when you drink icy water when you eat, you're actually going to slow down or decrease your digestion, because digestion requires heat, right? If I don't have enough heat in my system, because I constantly dump icy water into my food, I don't digest, right? So again, to replenish is I want to chew your food, make sure that you don't drink, sorry, cold water. That's why you notice that in certain culture, especially the Asian culture, we don't drink cold water, right? They always drink warm tea. Why is that? Because warm tea, right, is to help digestion, right? Not to slow down digestion. So in addition to chewing your food, don't drink icy cold water, right? You want to replenish digestive enzymes. And then number three, right? After replenish, what do we do? Then we want to re-inoculate. Right? Re-inoculate is where we talk about pre and probiotics. What is the difference or equal to symbiotics? Okay, so you heard the term prebiotic, probiotic. Probiotics are simply the good bacteria that we have in our gut, right? But the food that they eat is called prebiotics, right? And together, the new term is called symbiotics, which is a combination of pre and post, right? Pre and pro, right? And the most common food is what? Prebiotics, right? The food would be what? Would be fiber, right? And fermented food. Again, I'm sure Heather can tell you a lot more than I can in terms of, oh, please give me a list of prebiotics, right? So I will have you talk to her for details. I'm giving you overview, right? So we talked about removing things that you should not eat. We talked about replenish your digestive enzymes. We talked about re-inoculate with the appropriate pre and probiotics. Oh, there was a question here that are related. Someone asked me, how long should I continue taking digestive enzymes? And how often should we take probiotics? Okay, how long should I continue? That depends, right? As we get more mature, we probably are losing, right, our ability to make enzymes. So that would be like, Dr. Chan, I don't want to buy grocery. When can I stop eating? You tell me, when should I stop eating? I don't want to buy grocery. No, that could be lifelong. For as long as you are deficient in your digestive enzymes, you will need to continue to replenish it. Now, of course, there's a way to measure that, right? And that would be something that we can talk about. I will talk about that at the end, okay? But let's see. Good. So in general, one more time, as we lose our digestive enzymes, then yes, we will need to replenish it. Now there is I hope I'm not, okay, sorry. So far so good. Have I confused anyone? Have I put any one of you to sleep? I know I could be a natural ambient, right? I can talk to you and you don't need ambient anymore. Just make me talk. Then you will sleep very well. Hopefully not now. Okay, all right. So far so good. So where was I? So once again, as we continue maturing, you probably need to have continue to replenish your digestive enzymes. But then some of you may ask, but Dr. Chan, is there anything I can do to boost my production? Yeah, maybe. And that would be a higher level of discussion that I'll share with you. There are other things that we do using peptides. Right? And even certain stem cell therapy, right? which may be beyond the scope of our discussion today. But at least we know there is something out there, right? Peptides, something called BPC157, if I remember correctly, and you can look up online, right? That is a peptide that we use, right? And has a lot of good data, scientific research on how this or what is peptide? I'm sorry, peptide is simply means a long protein molecule. That's all. That's all you need to know. A very long protein molecule, right? That can do something for us. So there's a lot of scientific data that using a peptide such as BPC157 can help to improve your gut health. And I will start doing that in my office, but I want to go slow because I was told I may be too fast. So I go one small step at a time, right? We start with digestive enzymes, then we can then talk about the use of peptides, right? Peptide can help you to make more, right, digestive enzymes, for example. So, okay. But then you're gonna ask me, oh, but then Dr. Chan, if I start to use the peptides, does it mean I have to use it forever? Right? Yes, that's true, because you are also losing your natural ability to make peptides. That's true, right? So at some point, we will have to use our peptides on a daily basis, right, to stimulate my digestive enzymes. Okay. But the second question is, how often should I take my probiotic? That typically is once a day, right? Depends. If a patient that, how do I say that? For wellness purposes, for wellness, right? So typically once a day is enough, assuming you are taking good probiotics, not junk. I'm sorry, right? Because there are plenty of junk that you can find over the counter. But when you are sick with, for example, with irritable bowel syndrome or inflammatory bowel syndrome, then yeah, we may use it more frequently depending on your specific conditions. So minimum should be once a day, right? Depending on any ongoing medical condition, we may require higher dose, right? And also that depends on how much you have, right, in the capsule, right? When you are sick, the doses of the probiotics would typically be higher, right? Because many over the counter, maybe 1 billion, right? This doesn't do much. When you are sick, you need up to 100 billion per capsule to promote health. So that really depends on the type of probiotics that you are taking and your specific condition that you are having, right? There's still so much that we don't know, I can tell you that, right? But at least now, right, some doctors are already doing, I'm sure you know, right, fecal transplants, right? Which I don't like the idea, but you know, some patients will have such bad gut issue that they actually would benefit from fecal transplant, which is, taking someone else's poop and put in your gut, right? So I will stick with probiotics for now. Okay. So what is next? Make sure that I don't miss anything. Number 7, I am taking different supplements. Good. Yes, that depends, right? I would love you to bring me your supplements so that I would make sure that you're not overdosing, right? I don't want you to overdose. I know that oftentimes when we take different nutritional supplements, they come in a formula. A formula means it includes many different substances. Yes, there is always a chance that you can overdose, right? For example, you might take different combination of vitamin D, right? Very common, D3. And then you have like, oh, this bottle is 5,000 international units. And then another bottle is 2,000 international units, right? My gosh, when you add them together, that you may get overdose. So yes, please bring it to my attention. I should, see each one of them and then look it up for you to make sure that you don't get overdosed. And then I have been told that, next question. I have been told that I have calcium deposit. How can I remove excess calcium? Oh, okay. Well, we don't necessarily remove, but there are two things we need to do. We can balance your calcium with magnesium, right? So magnesium, you can think of magnesium as a natural opposite to affect for calcium. Another way is to make sure that especially when you take vitamin D, which will increase your calcium absorption, right? That's how vitamin D works. Vitamin D3 works by increasing your absorption of calcium. But you want to make sure that your calcium goes to your bones and your teeth, right? Not to your heart, your brain, or your kidneys. So you must make sure that whatever vitamin D calcium that you're taking, it has K2. K2 helps direct calcium into the bones and your teeth. One more time. Vitamin D3 increases calcium absorption from your gut. So your calcium level will be higher. But you want your calcium to go to bones and your teeth. How do I do that? Make sure that the vitamin D or calcium that you are taking has vitamin K2, right? And many over-the-counter vitamin D do not have K2 in it. So what's the problem? Well, then you may be getting too much calcium going to the wrong place, such as your kidney. And I don't want you to get kidney stones. Kidney stones is not fun. So therefore, please, when you get your vitamin D, make sure that they have K2 in it. And that's one way to help, right, remove the calcium or direct the calcium to the right place. If you're looking for, but Dr. Chen, I have enough calcium already. Is there a way to remove? Yes, that would be something I don't do in my office, but you could remove calcium, right, under, again, chelation therapy. Some doctors do that, right? I don't do that in my office because it takes a special license to do that in the office, right? For example, you probably have seen some naturopath do that, right? They will say, oh yeah, we do chelation therapy to remove excess calcium from your body, and we use IV EDTA, something like that, right? And like I said, yes, I don't do it in my office yet because I have to apply for a license to do it, right? So would that be something I do in the future? It depends, right? One thing at a time. Otherwise, you guys will complain to me that I'm too fast. So let's see. So I hope I answered that question, right? Again, make sure that you take K2 to help direct the calcium to the bones and the teeth. For those of you who have extra concern about calcium buildup, I could refer them to a chelation therapy practice that will do IV EDTA or equivalent to remove calcium. The next two questions is how long do I take? Yeah, I answered those already, right? How long do I take digestive enzymes? Depends, but that could be lifelong. Probiotics depends, minimum once a day or more, depending on your underlying medical condition. Last question here. Oh, this is something that would be homework for Ms. Schaefer, right? Different type of magnesium, but in general, right, magnesium, right, has, for example, if you use citrate or oxide, right, they're typically for, I am writing this down, for the most common, right, constipation. Right? So let me step back. Magnesium, when you buy something, right? It has two parts. Magnesium is the metal. The second part is the salt. That, right, like potassium chloride, right? You have a salt. So it is the salt that determines its function. So if you see magnesium citrate, magnesium oxide, they tend to be used for constipation. If you see magnesium glycinate, they tend to be used for, let's say, cardiac issue. Arrow, looking for arrow. Yeah, cardiac issue, including hypertension. If you go with my favorite, magnesium malate and sulfate, they are used for muscular issue, muscular tension, restless leg syndrome, right? I'm sure you're familiar. Restless leg syndrome, muscular tension. And then if we use magnesium threonate, if I spell correctly, I always have problems spelling it, right? It's for concentration, focus, concentration. And then you can have magnesium taurate. It's for anxiety and sleep, usually. Right, so those are the typical different type of magnesium, right? Magnesium citrate oxide for constipation, magnesium glycinate for heart, blood pressure, magnesium malate, by the way, magnesium sulfate is what? Is Epsom salt, right? That you can buy for Epsom salt. Please don't drink it. It's for external use only, right? You can bathe in it, right? For muscular issue, right? Relaxes your muscle. Threonate for focus, taurate, if I spell incorrectly, forgive me, for anxiety and sleep. So those are the basic ones that I think is good to know, right? Not all magnesium is the same. Okay, and again, I'm sure Heather can give you a more detailed academic level of magnesium information if you so desire. Okay, so I have answered all my questions on the list. Do you have anything for me other than what is written here? Or do you want me to repeat any one of them in case I speak too fast? No? How's the weather up there now?
Cold.
Is this snowing still or no?
No, the wind's picking up.
Oh. Okay.
Very informative.
Oh, I'm sorry. Yes, I missed 1 hour. You gave us 3 and not 4 and 5. Oh, okay. You're right. I'm so sorry. Okay, the number 4. So let's recap. Number 1. Thank you. Number 1 is remove. Number 2 is replenish. Number 3 is re-inoculate. How dumb. I'm so sorry. I need to do the restore you test myself. And then next one for repair is repair, right? And because now we actually go down and repair the gut lining, and we typically use the agent called glutamine and carnosine. Those are the top 2 nutritional agents we use to close the gap, right? And so there we go. So that is, I'm so sorry, this is the most important element, right? To repair the gut lining, right? Using glutamine and carnosine. And then finally would be rebalance. And that is not a supplement that I can give you. It has to do with stress management. right? Using, let's say, neural feedback or biofeedback. Okay? What do? They rebalance your autonomic nervous system, right? Especially the parasympathetic branch, right? The parasympathetic. The vagus nerve, basically, right? Is to, so in fact, I told Heather a week ago that I am very interested to bring, I think Dr. Morris used to do that a few years ago on using heart math, right? Institute, and they do something called arm wave.
Yeah, we did a little bit of heart math. I'm excited to get back into it again. For those of you that have been in Dr. Moore's practice for a little bit, we've done it wasn't called the 5 R's. I reduced it to 3 R's because I thought 5 was a lot, but 5 is definitely more specific. So ask me again if you want this, because I have lots of handouts about it. And the rebalance, as Dr. Chan said, that's a lot of lifestyle. That's a lot of stress because it's all connected. You know, this Dr. Chan has been answering beautifully, by the way. Thank you, Dr. Chan. Lots of questions about nutrition and how to get healthier through nutrition, which is an extremely important part of the holistic approach. But it shouldn't really take too much of the forefront because we still need the stress management. We still need the better sleep. We still need the exercise, and it all comes together quite beautifully. So, and they all work off of each other too. So if you're looking at nutrition or supplements as what we've been doing here, I think it's perfect. It's a really nice platform to sort of step off from, so you can exercise more, so you can understand stress management a little bit more, so you can do other lifestyle approaches that will really help the quality of your life.
Yeah, I want to piggyback from Heather here. The importance of diet versus nutrient. They are both important. When we talk about diet, right, we oftentimes refer to, or I refer to as macronutrients, right? So the big things like, you know, protein, fat, carb, right? Meat, vegetables, fruits, the big things. And of course, we want that, absolutely. So please understand that I am not here to sell you supplements. I am not a supplement company, right? Diet comes first, food comes first, right? Lifestyle, absolutely. But then the problem is, as we get more mature, again, we don't get old, we only get more mature, right? My digestive function goes down. What does that mean? That means even if I am eating the diet from the Garden of Eden, perfect food, no chemicals, everything organic, right? Made by God Himself. But that doesn't mean I now have the capacity to digest and absorb. So when that happens, we will begin to have nutrient deficiency. And we call that micronutrient deficiency, right? And that is typically what we refer to as vitamins and supplements. So why do we need supplements? We don't. If you are perfectly able to eat a good diet and with great digestion. But most people nowadays do not eat well, nor do they digest well, right? That's why, we want to focus on good diet, absolutely. But then we also have to, right, understand that we will be missing micronutrient because number one, we are losing our capacity to digest and absorb. That's number one. Number two is what? Even worse, in case you don't know, right? If I tell you that, I'm sorry, you're gonna hate me. I would be ashamed. I'm sorry. So let me apologize ahead of time. The second reason why you, all of you, have micronutrient deficiency is because of this medications that we give you. Medications that we give you, like candy, is a major source for nutritional depletion. If you don't believe me, look up. There's an entire textbook written, right, called drug. You can Google, don't believe me. Drug-induced nutrition or nutrient depletion. I guarantee you have textbooks written for that, right? Pharmacists know, doctors don't, but pharmacists know. Every drug I give you comes with some type of micronutrient depletion. For example, the most common drug that we give, well, one of the most common, metformin for diabetes, right? I use it like candy, but what does it do? It number one nutrient depletion is B12, right? You can look it up, right? The number one micronutrient that is being depleted by metformin for diabetes is B12. This, right? There you go. More common, right? I mean, you guys all know this. Statin, right? Cholesterol medication that many of you don't want to take. Why? Well, because it makes my muscle ache. Yeah. And it can increase my risk for diabetes. Yeah. Or maybe it can even increases my risk for dementia. Yeah. But what does it do? It number one depletion is what? CoQ10, right? It depletes CoQ10 and vitamin D. So every drug we give you, like candies, will take away some of your nutrients on top of the fact that you are not digesting and absorbing to begin with as we age. That's the problem. Okay? So I want you to be aware. That's why I do what I do. So anyway, I hope I apologize. Thank you so much for reminding me. I give you, it must be my ADHD thing. I forgot, right? My 5R program. So you got it. And then I also mentioned that for those of you who are interested down the road to really measure your gut function so that we can appropriately apply the 5R or the 3R, it doesn't matter, or approach, is to do the gut testing, right? We call that GI effect. But there is a poop, it's called CDSA. CDSA stands for Complete Digestive Stool Analysis. CDSA is something that we do to test your GI function, right? So that we know how to apply the 5R or 3R, okay? Well, but excuse me, Dr. Chan, did the GI doctor do that? No, because what does the GI doctor typically do? They do two things, right? They do EGD and colonoscopy. That's it. And that's not bad, right? Yes, that's absolutely necessary to make sure that you don't have structural problem, right? And EGD or colonoscopy that we need to do only tells you about structural problem. Do I see a blood clot? Do I see a major infection? Do I see a mass? Could that be cancer? Maybe a polyp, right? Structural. But simply structural issue does not tell you anything about function, right? Just like if I look at your computer, I can check your hardware. Does not tell me anything about your software. So oftentimes, GI doctor would say, I don't know what's wrong with you because your EGD is fine, your colonoscopy is fine, Nothing's wrong with you. I don't know what to do. Go back to your primary care doctor. Bye. Right? The issue is no, they need to measure your function. How do we test for your gut function? That is not something that EGD or endoscopy, right? Or endoscopy, right? EGD or colonoscopy can show. So when that happens, then I would recommend looking at number one, food allergies, and number two would be to look at GI function by looking at your stool test. That's all, right? So if for those of you who are curious about Dr. Chan, what tests do you do to justify your 5R program? That's all. Great. Anything else? Good. I am sure that you guys will sleep very well tonight after you listen to me.
Thank you, Dr. Chan.
Thank you.
Good. I will see you next week. I mean, in my office. Have a great weekend.
Bye,
Bye.
everybody. Thank you.
Bye-bye.